Hey there, I'm Dr. Vladimir Bariev, a general pediatrician specializing in autism for children, and today I want to talk about sensory processing disorders. I know we talk about a lot of different things here, and today I want to dive into something that might be new to some of you. So, one important thing to keep in mind about sensory processing disorders is that the current medical consensus, as organized by the Diagnostic and Statistical Manual, the DSM-5, does not have any separate set of conditions known as sensory processing disorders. So there is no official medical criteria for diagnosing this condition or this set of conditions. So it makes this subject a little bit more challenging to talk about, and it leans more heavily on professional experiences. So take that with a massive grain of salt. Now, sensory processing disorders, one of those things that once you start learning about them, you begin to see them everywhere. It's like when you buy a new car, and suddenly you notice that same model on every street. But in this case, it's about understanding how people experience the world around them. I want to talk about this today, not so much as a medical professional talking at you, but more as a friend having a heart-to-heart. Because at the end of the day, we are trying to make sense of this big and sometimes overwhelming world. And understanding sensory processing disorders can really help us make a little bit more sense of it all for ourselves and someone we really care about. So what exactly are sensory processing disorders? Well, in simple terms, these are complex neurodevelopmental conditions. Okay, big words, I know. Let's break it down. Neurodevelopmental means it has to do with how the brain and the nervous system develop. And complex, well, that just means it's not always straightforward. Essentially, sensory processing disorders involve difficulties in how our brains detect, modulate, interpret, and respond to sensory experiences. Think of it like this. Our senses are constantly feeding information into our brain. And we've got 8 of them. That's right, 8 of them. So the 5 usual ones that we're used to are sense of sight and hearing and touch and taste and smell. But we also have senses like balance. That's called our vestibular sense. The location of our body in space, that's called our proprioception, and even our internal sensations, like when we're hungry or we feel headaches or pain, and that is interoception. So for someone with a sensory processing disorder, their brain has trouble organizing and responding to all of that information. It's like a traffic jam in the brain's sensory processing center. Things that might seem normal or even unnoticeable to most of us can feel overwhelming, confusing, or straight weird to somebody with a sensory processing disorder. And this is not just some minor inconvenience. These challenges can significantly impact a person's ability to participate in everyday life. I want you to try to imagine focus in a noisy room when every sound feels like a jackhammer in your head, or trying to walk across a room when you constantly feel like you're on a boat and everything is floating around you. That's the kind of thing we're talking about. It's also really important to know that sensory processing disorders often co-occur with other neurodevelopmental conditions. You might have heard of Autism Spectrum Disorder or Attention Deficit Hyperactivity Disorder, which was formerly known as ADD and currently known as ADHD. Sensory processing disorders are frequently seen alongside these, and it can make things even more complex. Now, let's get into the different types of sensory processing disorders. It's not just one thing. There's actually a few different categories, and within those categories, there are subtypes. Think of it like different flavors of the same thing. The first type is called Sensory Modulation Disorder. This is all about how we regulate our responses to sensory input. And within sensory modulation disorder, we have a few different ways it can show up. First is being overly responsive, or sensory overresponsivity. Imagine your senses are turned up to 11 all the time. That's what overresponsivity feels like. People with sensory overresponsivity have exaggerated responses to anything that triggers their senses. Noise might physically hurt them. Gentle touch on their skin could feel like they're being burned. A bright light could make them feel like they're blinded. It's just that their volume control for the sensory input is broken and everything is way too loud. Then there's the opposite, sensory under-responsivity on the flip side. This is where you have a diminished response to a sensory stimuli. Now, they might not react to things that would bother other people, or they might need a lot more stimulation to even notice something. It's like their volume control is turned way down and everything sounds so low. So then we have sensory seeking or craving. These are the folks who are constantly seeking out sensory input. They may fidget all the time, crash into things, or crave intense sensations. It's like they're trying to turn up their own internal volume because it feels too low. Something to take off the edge and make them feel alive. The second main type is called sensory discrimination disorder. This one is where someone has difficulty accurately perceiving and interpreting sensory information. It's not necessarily about the intensity of the sensation. It's more about understanding what it is. For example, they may have trouble telling the difference between different textures, or they might struggle to locate where a sound is coming from. And finally, we have sensory-based motor disorder. This one affects movement and coordination. There are a couple of subtypes here too. You have a postural disorder, which involves problems with balance and core stability. Someone with a postural disorder might seem clumsy, have trouble with coordination, or struggle to maintain their balance. Then you have dyspraxia, and that's a big one. Dyspraxia is a condition that affects motor planning and sequencing movements. So it's like when you want to have your arm reach out and grab a cup, the brain has trouble sending the signal to the right parts of the body to perform that task. So you don't end up doing it quite like you wanted to. This can show up as difficulty with things like getting dressed, playing sports, or even just writing. Dyspraxia can show up in all of the different areas that you use in daily life. Now, I really want to emphasize how much sensory processing disorders can impact someone's life. It's not just about being a little picky or being a little sensitive. It can affect everything from their ability to learn and socialize all the way to their emotional well-being. I'm talking about things like anxiety and depression and feeling overwhelmed, overstimulated. So I want you to imagine a child who is constantly overwhelmed by the noise and activity of a classroom. They may have trouble focusing, they get easily distracted, or withdraw from social interaction. Or think about an adult who struggles with the sensory overload of a busy office environment. They may feel anxious, irritable, or have difficulty concentrating on their work. Sensory processing disorders can also make it hard to regulate emotions. When your sensory system is constantly on high alert, it can be really difficult to stay calm and manage your feelings. I want you to try to imagine feeling really calm if you are in the middle of a war zone, or trying to feel really calm when you are exhausted and sweaty from a room that's way too hot for you. You're going to probably lose your temper. This can lead to meltdowns, anxiety, depression, and other mental health challenges. Now, as I mentioned earlier, sensory processing disorders often co-occur with other neurodevelopmental disorders. When it comes to autism spectrum disorder, atypical sensory experiences are extremely common in autism. Up to 90% of people on the spectrum have sensory processing disorder. There's a massive overlap, and it's important to understand that sensory sensitivities are a core part of the autistic experience for many people. With ADHD, sensory processing difficulties are also frequently reported in children. Studies suggest that anywhere from 50 to 64% of children with ADHD also experience sensory processing challenges. This can make it even harder for them to focus, control their impulses, and manage their energy levels. This co-occurrence can make it tricky to tease apart what's what. Is the sensory processing causing the problem with attention, or is it their ADHD? It's usually a combination of both, and it requires a really careful and nuanced approach to understanding and supporting the individual. So how do we figure out if someone has a sensory processing disorder? Well, it's not always easy, and it usually involves a team effort. It often starts at home with parents, in school with teachers, and family members. You notice something that seems different, or a person is having an unusual reaction to a certain sensory input. We have professionals get involved. So the ones that do the brunt of the work with helping people manage sensory processing disorders are going to be our wonderful friends, the occupational therapists. They are the key players in assessing and treating sensory processing disorders. They are trained to evaluate sensory processing and how it impacts a child's daily life. Now, once a diagnosis is made, what can we do about it? The good news is that there are treatments and interventions that can really make a difference. Do they always work? Well, it's not always so simple. You see, looking deep within the research on certain therapies for sensory processing disorders, you see that sometimes these therapies are effective and sometimes they're not. So the data is very inconsistent. What that means for us today is that you're going to see that the treatment approaches to people with sensory processing disorder will definitely continue to change over time. We are not at the final version of helping people manage these conditions quite yet. We are still learning and observing what helps the most. So clinicians today, they're just doing their best to help kids out, even with limitations in our research data. So with occupational therapists, so these therapists use a variety of techniques to help people learn to better process and respond to sensory input. And this might involve things like sensory integration therapy. This is a specific type of occupational therapy that involves providing controlled sensory experiences in a playful and engaging way. And the goal is to help the brain learn to better organize and integrate sensory information. Then, putting children on sensory diets. These are personalized plans that provide specific sensory activities throughout the day to help regulate that individual's sensory system. There are some newer and emerging treatments that are showing promise, which we may see more of down the road, and one of which is neuromodulation, which involves using technology to stimulate specific areas of the brain and improve sensory processing. And of course, virtual reality. You can create a controlled sensory environment to help people practice coping with challenging sensory situations. So, early identification and intervention are important with any condition that affects the brain. The sooner is identified and intervened upon, the more likely you are to adjust the trajectory of that condition. All right. So to wrap it all up, sensory processing disorders are complex conditions that affect how individuals process sensory information. This can have a profound impact on their daily functioning, their social interactions, and their overall quality of life. So it's important that we continue to raise awareness about sensory processing disorders, to continue to support research, and continue to develop effective treatments. Because everybody deserves to be able to navigate the world in a way that feels comfortable and manageable. If you are living in New York State and looking for support in navigating autism, please reach out to our office. Office number is 917-819-5056. Once again, it's 917-819-5056. And we are here to help you and your child every step of the way. Thank you so much for joining me today. I hope this has been helpful. And until next time, take care and be kind to yourselves and others.